Good day, everyone. Today, we will be discussing rehabilitation for specific injuries. Our focus will be on the lower extremity, hip, pelvis, and thigh. So, these parts are very important, especially for athletes and students who are active in sports, dancing, and physical activities. We will talk about the common injuries, their causes, symptoms, and the proper rehabilitation exercises to recover safely. To begin, let's first understand why the lower body is so important and why injuries often happen here. The lower body includes our legs, hips, pelvis, and thighs. These body parts carry our weight and make it possible for us to walk, run, jump, and move freely. Because they are always working hard, they are also at risk of injuries. Injuries may happen during sports, exercise, or even in simple daily activities such as walking, climbing stairs, or lifting heavy things. Rehabilitation is very important because it helps the body heal faster, reduces pain, and lowers the chance of getting the same injury again. Without proper rehab, an injury might return or even get worse. I know some of you here have experienced knee pain, most especially if you play sports like volleyball or basketball, or even hip pain after a long hours of dancing. That's why rehabilitation helps us to get back to moving without pain. Now, let's go deeper and look at the most common injuries in the lower extremity or the lower part of our leg. Here are the 4 common injuries in the lower extremity. Let's discuss them one by one. The first injury is what we call as ankle sprain. An ankle sprain happens when your ankle suddenly twists or rolls. This often occurs in basketball, volleyball, or running. You will notice swelling, bruising, and pain when you step or walk. The rehabilitation includes RISE method, which is rest, ice, compression, and evaluation. So these are the rehabilitation exercises for ankle sprain. First is we have the ankle alphabet. You have to lie down and lift your leg upward. Lift the heel of your affected foot off the floor and slowly trace the letters of the alphabet. It's a good idea to repeat these steps with your other foot. Next is we have side-to-side knee swing. First, we have to sit in a chair with your affected foot flat on the floor. Second, slowly move your knee from side to side. Keep your foot pressed flat. Continue this exercise for 2 to 3 minutes. Next is we have the calf stretch, seated knee straight. First is we have to sit on the floor with your affected leg straight and resting on the floor. Second, we have to place a towel around your affected foot. Third, we have to hold one end of the towel in each hand. Next is we have to pull back gently with the towel so that you feel a stretch in your calf. Hold the position for 15 to 30 seconds. Repeat 2 to 4 times. Now let's talk about the shin splints. Shin splints cause pain in the front of the shin bone. This usually happens when you run too much, especially on hard surfaces, or if you suddenly increase your running activity. Rehabilitation includes resting, stretching, and wearing proper shoes with good support. During my PE jogging session in my class, there are some students who are not used to running, which may feel shin pain, and that is what we call a shin splint. These are the rehabilitation exercises for shin splints. First is we have the hamstring stretch in a doorway. First, you have to lie down with your other leg through the doorway. Be sure to stretch your affected leg. Hold the stretch for at least 1 to 6 minutes. Repeat 2 to 4 times. Next is we have the shin muscle stretch. First, we have to sit in a chair with both feet flat on the floor. Second, bend your affected leg under the chair so that the top of your foot near your toes is flat on the floor, and your toes are pointed behind you away from your body. If you need to, you can hold on the sides of the chair for support. Hold this stretch for 15 to 30 seconds and then relax. Then repeat 2 to 4 times. The next injury is what we call as plantar fasciitis. This injury affects the heel and is common in people with flat feet or those who walk and stand for long periods. The pain is usually strongest in the morning. This injury mostly happened to the teacher kasi manugbarog every day for a long period of time. So the rehabilitation exercises include the calf stretching and rolling the foot on a tennis ball to massage and relax the muscles. These are the rehabilitation exercises for plantar fasciitis. First is the calf stretch. We can still apply this type of exercises to this kind of injury. So we have to sit on the floor with your affected leg straight and resting on the floor. Second, place a towel around your affected foot. Third, hold one end of the towel in each hand. Next is pull back gently with the towel so that you feel a stretch in your calf. And hold the position for 15 to 30 seconds. Repeat 2 to 4 times. Next is we have calf stretch, back knee straight. First, we have to stand facing a wall with your hands on the wall. You can also do this with your hands on the back of a chair or a tree. Put one leg about a step behind your other leg with your toes pointing forward. Keep your back leg straight and your back heel on the floor. Bend your front knee and gently bring your hip and chest forward the wall until you feel a stretch in the calf of your back leg. Hold the stretch for 15 to 30 seconds. Repeat 2 to 4 times for each leg. Next is Achilles tendinitis. This injury is common in sports that require a lot of jumping, like volleyball and basketball. The pain is felt at the back of the heel. So for the rehabilitation exercises, which include the calf raises and stretching, but you must return to activity slowly to avoid making the injury worse. These are the rehabilitation exercises for Achilles tendinitis. First is we have the passive toe stretch. First is sit on the floor with the heel of your affected foot on the floor. Use one hand to hold your foot steady. Second, using the thumb and index, pointing finger on your other hand, slowly bend your toe forward and then backward. Hold each position for about 15 seconds. Repeat 2 to 4 times. Next is we have the calf stretch. Still, we can apply these exercises to this type of injury. First, we have to sit on the floor with your affected legs straight and resting on the floor. Second, place a towel around your affected foot. Third, hold one end of the towel in each hand. Fourth, pull back gently with the towel so that you feel stretch in your calf. Hold the position for 15 to 30 seconds. Repeat 2 to 4 times.
Now let's move on to the injuries in the hip, pelvis, and thigh. So these body parts are very important because they give us strength and power for movements such as running, jumping, and kicking. They also provide stability when we walk, stand, or even sit. However, because these areas are heavily used in sports and daily activities, they are also prone to injuries. So I will discuss four common injuries. First is the hip strain. A hip strain happens when the muscles around the hip are overstretched or torn. This usually occurs during sudden movements such as sprinting, twisting, or kicking, especially when the body isn't warmed up properly. So for the causes of hip strain, first is the sudden twisting motions in basketball, football, or martial arts. Next is overstretching the leg while kicking and the lack of warm up or muscle fatigue. So for the symptoms, first sharp or dull pain in the hip area, muscle stiffness, making it hard to move freely, and in severe cases, swelling or bruising. Now for the rehabilitation, first rest the injured area to prevent further damage. Second, apply gentle stretching after the pain starts to decrease. And third, later, strengthening exercises such as side leg raises or resistance band workouts to help rebuild strength. Now, to prevent this kind of injury, first, always warm up before sports. Also, stretch hip flexors and glute muscles regularly. And maintain proper flexibility and avoid overtraining. So if an athlete feels sudden hip pain, it's important to rest and not force a movement.
Single leg balance. First, stand on a flat surface with your arms stretched out to your sides like you are making the letter T. Then, lift your good leg off the floor, bending it at the knee. If you are not steady, use one hand to hold onto a chair, counter, or wall. Standing on your affected leg, keep that knee straight. Try to balance on that leg for up to 30 seconds and then rest. And then repeat it 8 to 12 times. It's a good idea to repeat the steps with your other leg. Hip extension or standing. First, stand facing a wall with your hands on the wall at about chest level. Second, keeping the knee of your affected leg straight. Kick that leg straight back behind you. Slowly lower your leg back to the starting position and then repeat it 8 to 12 times. It's a good idea to repeat the steps with your other leg. Hamstring set or seated. First, sit with your affected leg bent. Your other leg should be straight and resting on the floor. Second, tighten the muscles on the back of your bent leg or the hamstring by pressing your heel into the floor. Third, hold for about 6 seconds and then rest. Fourth, repeat 8 to 12 times. Fifth, it's a good idea to repeat these steps with your other leg.
The second injury is pelvic stress fracture. So this injury is a tiny crack in the pelvic bone caused by repetitive stress. So unlike a sudden break, this injury develops slowly over time due to repeated impact. So this is common um, to long distance runners because of repetitive pounding on hard surfaces, dancers who jump and land repeatedly, overtraining without enough rest, poor nutrition or low calcium which weakens bones. So for the symptoms in this injury, this includes deep pain in the pelvis, especially during running or jumping, pain that worsens with activity but eases with rest, and difficulty walking in severe cases. So for rehabilitation for this fracture, the first and most important step is full rest. No? So magpahuwalay jud to let the bone heal and use crutches if needed to avoid putting pressure on the pelvis. Gradually return to light activity after several weeks and strengthening exercises such as core training and resistant band workouts to prevent re-injury. Now, for prevention of this injury, to prevent this, of course, proper footwear to absorb impact. Second, cross training like swimming or cycling to avoid overuse. And eating calcium and vitamin D rich foods for strong bones and avoid sudden increases in training intensity. So pelvic stress fractures requires patience. Returning too soon can make the fracture worse.
Bridging exercise or supine is an exercise which increases muscular strength of the hip extensors and promotes trunk stability. When performed correctly, a bridge exercise can help promote better posture. So it is often prescribed for patients with back pain and increases the activities of trunk stabilization muscles such as the internal oblique, external oblique, and erector spinae muscles. Individuals with back and hip pathologies are often taught to perform the bridging exercise in the crook lying position, elevating the pelvis off the floor. This exercise is particularly useful for facilitating pelvic motions and strengthening the low back and hip extensors, and it enhances motor control of the lumbo-pelvic region. So, for the technique of this exercise, the patient lies down with the back, knees in full flexion, and feet flat on the floor and close to the bottom. Then the patient lift hip off the floor towards the ceiling or the sky as possible.
Quadriceps contusion or simply a thigh bruise. So this happens when the front thigh muscles get hit directly, usually during collisions in contact sports like basketball, soccer, or rugby. So common causes for this injury. So direct impact from another player's knee, elbow, or ball. Second, falling and hitting the thigh on a hard surface. For the symptoms, first, immediate pain in the thigh. Second, swelling and a visible bruise, and difficulty bending the knee or walking. For the rehabilitation, first, rise method in the first 48 hours. Rest, um, el- rest, ice, compression, and elevation, as I said earlier. Second, gentle stretching to keep muscles from tightening, and massage to improve blood flow and reduce stiffness. And lastly, gradual return to full activity. So to prevent this, wearing thigh pads in contact sports, strengthening quadriceps to absorb impact better, and using proper technique when colliding or tackling. Though it sounds minor, if ignored, a quadriceps contusion can lead to serious complications like muscle hardening.
The quad stretch or standing. If you are steady in your feet, stand while holding onto a chair or a counter or while resting your hand on a wall. You can also lie on your stomach on your side to do this exercise. Bend the knee of the leg you want to stretch, and then reach back with the hand on the same side and grab the front of your foot. Quad stretch lying on side. First, lie on your side with your affected leg on top. You can use your hand or a pillow to support your head. Bend your top leg and reach behind you to grab the front of that foot or ankle with your other hand. Stretch your leg back by pulling your foot toward your buttock. You will feel the stretch in the front of your thigh. Hold the stretch for at least 15 to 30 seconds and then repeat it 2 to 4 times. It's a good idea to repeat these steps with your other leg.
So to summarize, injuries in the hip, pelvis, and thigh are common among athletes because these areas carry much of our body's movement power. So hip strains happen from overstretching, pelvic stress fractures are from repetitive stress, hamstring strains occur during sprints and sudden stops, and quadriceps contusions result from direct blows. So the key to managing these injuries is early recognition, proper rehabilitation, and prevention through warm-ups, stretching, strengthening, and protective gear. Always remember, prevention is better than cure. Thank you, and I hope this lesson helps you take care of your hips, pelvis, and thighs.